Good morning, Dr. Lebowitz, Long Island Gynecomastia Center. So it's mid-July, and we're doing, of course, gynecomastia. Got this young man, he's 35 years old, local guy from New York. Now, interesting, he used to be, in great shape, but, life, job, family, kids, you get in your way, you stop going to the gym as much as you used to, you eat because, you got a family and your wife's making food for the kids and making food, pasta and, shit like that for the kids, and you says, oh, I'll freaking eat it. Pizza, I'll freaking eat it. So he had gynecomastia surgery done as a late teenager by a local doctor here in New York. And I don't know what his weight was many years ago. He was probably skinnier on that, but now make a muscle. And this surgery was not by me, by somebody else, local guy. But you can see this concavity here. He's got great muscle. I mean, he used to be a bodybuilder. Muscle here, I could see a hint of a six-pack there. But, this is no good. But I don't know what he weighed, many years ago. What this doctor did did aggressive gland removal, but really no liposuction. See, you need this. You need, this side boob and contoured. So I'm going to do Vaser high definition power assisted liposculpture. Not going to go much into this nipple here on either side because lift up all the way. He's got nothing there. I mean, he feels around it, but that's fat and probably scar tissue. This nipple is adherent to the freaking underlying, muscle. You can see the donut hole right there. So I need to scope this around, whittle this down, and definitely pectoral fat grafting. Now, people in their head, so I don't want a big chest, but he looks good, relaxed, and down because he's good muscle mass, and the muscle mass drops into that. But if he makes a muscle, that's weird. And of course, when he lifts up, you got a big donut hole here. All again under local anesthesia. Now, local anesthesia is not, once in a while you're gonna feel, ooh, ow, ee. But you tell me, I give you more local. But it's so much better than going under general anesthesia, especially with this pandemic. You don't want to be on a respirator or a ventilator or a tube in your throat in this. You just don't want to do it. So sometimes if I'm going a little too far, you'll say, Doc, I feel that. I go, oh, I'm going too far, or I'll give you more local. But this is better than under general because I am the best at this local. Anyway, enough talking. Let's get into it. Another one. All right, 2-ring, 70 Vaser. Let's rock and roll. First, we're gonna free the nip from the muscle, from that competitor of mine who did the surgery, local doctor in New York, who didn't do good lipo. So, and they did it under general, no?
Yeah.
Yeah, he did it at this doctor.
I was out.
Does it under general. All right, so here we are, breaking up some of the scar tissue from the previous surgery. So here we are, we're at the semilunaris, and I'm gonna start to melt the fat and tighten the skin lateral to that, down to the waist. And then from there into the armpits, and from there, the six-pack. So, nice and numb. You know, local anesthesia is local anesthesia. So every once in a while he's gonna say, "Ooh, I feel that." And I go, either I'm going too low, or I gotta give him more local. So here we are, we vasored. I'm using my micro-air powered liposculpting instrument, Mercedes, 4mm, don't need 5, don't need 3, and the extra long so I can get really where I want to get. And when I do my work, I do it. I mean, I don't compromise. So first, you don't have to suck too much out underneath the nipple. Just I want to release it a little bit to free that attachment of the nipple from the muscle. So I'm going to do a little lipo filling in there. So here we are, we're doing the semilunaris, which is the lateral edge of the rectus muscle, going down to his belly. And I'm using the long instrument. He again, we didn't, he said no abdomen, because he wanted to keep the cost down, but you know something, he's here, he's been through a lot, and let's blow him away with the results here. Really blow it away here. We're getting the waist from the waist. Get some good work here. Taking a break for a second, so I want to talk to you about what I'm doing. So I'm emptying the space now between the lats and the six-pack and the pectoralis major muscle. I'm going to do some lipo filling here. In a few minutes, I'm going to do my curved cannulas. Once I do this side, I'm really concentrating on this side. I'm going to shoot for a liter of fat. I got already about 900, so we have 100, 150. All right.
So he can move that hand and give you what you want.
Mm-hmm.
Excellent. Perfection.
All right, so as you can see, guys, I've got a great negative space here. And he's swollen because it's, under local. So now I've got my curved cannulas. I bent them myself, going around the nipple. Right there is where I am. And I'm really just more defining this space right here. Swing around here, go over here. We did Vaser, high definition liposculpture with micro-air, curved, straight, made lines, made shadow, did the pecs, the lats, the six-pack, the serratus anterior muscle, got out 2 liter 600. 2 liter 600 total. So now we're doing skin tightening with Renuvion J Plasma. And this is the, right there, you can see it arching. Nah. Anyway, so here we go. So now we do tightening. Okay, so here we are. Gonna do some beautiful lipo filling, even under the nipple a little bit. He doesn't want his nipple to be big, but he just has, from that other doctor, just taking too much gland out and not doing appropriate, high definition lipo. So right in here, it's inside the muscle, so there's high survival rate of the fat. And let's do some nice pushing and pulling. So lipo filling as we speak. Always know where your tip is. Right, sir?
Mm-hmm.
All right.
I'm not gonna say it.
All right, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. Vaser, high definition power assisted liposculpture, gynecomastia. Actually, he had gynecomastia gland removal by a competitor of mine in New York, but it took out too much gland and did no anatomical liposculpting high definition dynamic the way I do it. So he came to me to sculpt, contour the glands. They didn't have to be removed because they were resected before, actually over resected with not enough lipo. So I did the high definition dynamic 4D lipo contouring, sculpting. I did Renuvion J plasma to tighten everything up. And I did lipofilling of his pectoralis major muscle. Enough of that. You want the results I give you with lipofilling dynamic 4 definition 4D dynamic high definition liposculpture. You call me Dr. Lebowitz 631-424-0101 or email me at jonathanleibowitz@gmail.com. Thanks, and we will see you soon.